daily health. Let's talk about it. If you or your child has been feeling sick lately, you're not alone.
Yeah, flu-like illnesses soaring across the country right now. It is so bad that dozens of school districts have been forced to close their doors, cancel classes while they deal with the outbreak. Here's NBC News correspondent Maggie Vespa.
My son is homesick. He's got fever.
A savage flu season is taking aim at America's kids. At least 41 states and Washington, D.C. are reporting high or very high levels of influenza-like illnesses, with cases soaring among children. Indiana seeing a nearly 32% increase of kids as young as 5 showing up in ERs with flu-like symptoms. Across the country, dozens of districts forced to cancel classes.
Flu is the main driver, but we're also seeing COVID virus, RSV, and the Norovirus. So all four together overwhelming the system.
More than 1,700 students, 200 staff members, even 15 bus drivers were marked absent near Louisville because of widespread illness. In Tennessee, more than 70 schools closed. Across parts of southwest Ohio and northern Kentucky, at least 16 schools shut down these last few weeks.
We had the COVID outbreak and we had to, we shut down for a long time.
Flu season typically lasts from October through May, with its peak occurring in January. Some experts say this year's peak is hitting later and harder.
Right now, we're seeing pretty much peak activity across the entire country, all at about the same time.
The CDC estimates there have been at least 250,000 hospitalizations and 11,000 flu deaths so far this season, including 16 pediatric deaths just this week. Maggie Vespa, NBC News.
Maggie, thank you. Let's now bring in NBC News medical analyst Dr. Vin Gupta. So, Dr. Gupta, how concerned should we be about this rise in cases, and when should parents think about keeping their kids home from school?
Basically, this is to be expected, but this is a pretty significant increase in cases. And for parents out there, this is critical. If your child wakes up with a cough accompanied with fevers, chills, or body aches, that's where I would say keep your child at home, get them tested, see their pediatrician. If it's just a cough, talk to your school, nursing about potential things that you could do in addition to keeping them home. And it's also never too early to train your children on how to wash their hands and just to remind them on good techniques.
Yeah, sweeping through my kids' college campuses as well right now. We're talking 4 different viruses, right? But they have similar symptoms. So how do we know what we have? How do we protect ourselves?
Kate, it's really hard. And short of testing, it's very hard to disintermediate without a test, because you're right, cough and cold can mean a lot of different things. This is where, number one, if you have not gotten vaccinated for COVID or flu, or if you're 16 and older, RSV, it's not too late. End of March is the end of the season, so you still have time. Also, hand hygiene, critical. I would really recommend too, if you're in a plane, especially if you're medically higher risk, to mask up. There's nothing, it's not going to hurt. It's a good thing to do.
Tips. And Dr. Gupta, I also want to ask about bird flu, because health officials say a new type of bird flu has actually been found in dairy cows for the first time ever. What should we know about that? And how safe is it to eat chickens and cows now?
Cooked chicken, cooked beef, it's still safe, because we know that the virus it does not survive high temperatures, those needed to cook these things properly. So proper cooking, it's still safe, beef and chicken. And that goes for eggs, by the way, as well. This new virus, this new version, this new variant, we're seeing this occasionally in humans. So this is something that, so the one death that we saw in Louisiana, as in Clay, was because of this new variant. It was a 65-year-old individual with pre-existing conditions. We have to keep an eye out on it. This basically means that this virus can change pretty quickly.
All right, Dr. Vin Gupta, thanks so much.
Let's make time now for some